Good morning, ma'am. By the way, I'm Marlene Hope Larego, your student nurse for today. So, ma'am, can you state your name for me?
I'm Grail Magawa.
Okay, so what do you want me to call you?
Lee.
Okay, so ma'am Lee, so I'm going to explain first to you what we are going to do.
Okay.
I'm going to check your private area. Is that okay with you?
No. Yeah, maybe.
But I'm going to explain to you why it is necessary to check it.
Okay.
So
Okay.
we are going to check to find out if there is any significant diseases or any signs of symptoms of to prevent also if you have further diagnosis, right?
Okay.
So is that okay with you, ma'am?
Yeah.
Okay. So before that, by the way, I already performed my hand hygiene and I already wear my gloves for further protections and to prevent the contaminations of the infections. So first, before ma'am, I'm going to uh, ask you your past history for basis for this assessment. Okay, ma'am?
Yeah.
So first, I'm going to ask you, what is your age when you had the menstruation?
I think around 14 or 13 years old.
Okay, so when is your last menstrual period?
Last month.
Last month. So do you experience regular cycle of your menstruation?
No.
How about the length or regular ba or abnormal? Parang minsan-minsan ba meron or madalas nawawala pag ganun?
It's regular for around 3 days minimum. Yeah.
Okay, so how about yung flow? Madami ba siya or small amount of blood?
Katamtaman lang.
Katamtaman lang. Okay? So, when you had a menstruation, is it painful? The experience yung parang pinipisangay, ano lang mo, parang masakit?
No.
Do you experience pain in your back, during menstruations?
I experience pain in my back sometimes.
Okay. And do you had a sex intercourse?
No, oh my gosh. No, I'm still young.
Okay, so vaginal discharge. Do you experience any pain in your vagina or anything?
No.
Okay. So do you had a number of pregnancies? Do you experience with that?
I'm not pregnant.
Okay. So because you had no number of pregnancies, because you had no experience of sexual intercourse, and you had no labor experience, so we're going to for further history of your past.
Okay.
I'm going to ask further about your urination. So do you frequently urinate during night?
No.
How about, do you experience any blood when you had urinations?
No.
None. Okay, so do you experience any painful when you urinate?
No.
Incontinences or any
No.
pain? Okay, so do you had a history of sexual transmitted disease for past?
No.
Present? Okay, not.
No.
Thank you. So going further for the assessment, first I'm going to show you how the patient's position in doing the assessment. So first, because we need to cover the sheet, we need to cover the pelvic area with a sheet or drape at all times when not actually being examined. So we're going to imagine that the patient had a gown, nakasuot siya ng gown, and then for the privacy of our patient, we need to cover it with a sheet or a drape. And then I'm going to show you how the patient in a supine position. So ma'am, can you lay down? Okay, thank you. And then with feet elevated instead of examination disabled. Alternately, we're going to assess the patient to raise her feet. And then we're going to show you how in a dorsal recumbent position. Okay, ganyan siya. And for the hospital setting, there is something we put it high in the thighs of flex stirrups and externally rotated. So for now, the position of our patient is like this, and we need to cover a sheet, especially when we are not, doing, hindi pa natin ginagawa yung assessment, for to protect her privacy. Especially this is the most embarrassing for the patient. Okay, so we need to make sure that our patient also comfortable. So first, we're going to inspect the genital area of our female. So in inspecting, we're going to inspect first the pubic hair that surrounds the genital, around the vulva of a female genital area. So some women has less and some are more pubic hair in surrounds the genital area, and this is normal, and some patients has shaved their pubic hair and some are not, and then as it grows the hair become curly, as we notice, uh, but in the demonstration in this diagram, it full in the surrounding of the genital area. It distribute around the vulva of the genital area. Next, we're going to inspect the parasites, any parasites that surrounds the skin of the pubic area, and if there is any inflammations that surrounds the pubic area and any swelling, we're going to inspect that, and we're going to see if kapag may tumubo na dito, or kapag, especially kapag binunot mo yung isa dito, merong tutubo because merong pores kasi na, ayan, kapag nadumihan or nanagyan ng in some instances merong tutubo na parang pimples na sinasabi. And then we need to observe that, we need to see if there is any inflammation and swelling, to assess the pubis skin adequately, and we're going to separate this labia majora and then labia minora to see the pubis skin inside of it. So dito yung external, pero kapag binuka siya, makikita natin yung nasa loob, and it's pinkish when it's decided. Okay? Next, we're going to inspect the clitoris. So, ito po yung clitoris natin. And then, we're going to inspect the urethral phase. Urethral. So, dito yung umiihi yung patient. And ito yung, yung opening for vaginal orifice. So, in separating the labia minora, we can see the clitoris, the urethral orifice, and vaginal orifice. It is important to check the surrounding inside, the surrounding in opening the labia minora. We can see kung meron bang tumubo dito sa gilid-gilid niya or sa loob, or any swelling or inflammation. So we need to be careful and inspect the genital area of our patient. So lastly, we're going to palpate the inguinal lymph nodes. So here, sa inguinal lymph nodes ng patient, ng female natin, is mapapansin natin dito ngayon yung nakasurround. So we're going to palpate it here. Kung dito yung yung part kung saan yung dito, kapag dito yung abdomen ng patient, tapos dito yung part, kapag nakatayo yung patient natin, parang dito yung womb, sa womb niya. So we're going to, sa malapit, we're going to palpate it here and here, to see any swelling or any inflammation din. Kung makita din natin kung merong bukol. Okay, so after that, we're going to assess, after palpating the inguinal lymph nodes of our patient, so we're going to assess the patient in her comfortable position. In making our patient comfortable, we need to, because nakashow kanina yung privacy area niya, we need to cover it with a drape or a blanket para hindi din siya malamigan, and for her privacy also. After that, we're going to do aftercare equipment. So we're going to remove the equipment that we have used and clean it, and after that, we're going to perform hanagen and put the gloves in the trash can, and then we're going to document findings on the client record.